People in intensive care units are often very sick with complex medical and surgical issues. Long-term stays can be very stressful and difficult for patients and their families. That's why a group of nurses at Mayo Clinic have developed a program geared at making time in the ICU as peaceful as possible. It's called Core Nursing, and in addition to making the experience better for patients, it may also help get them better faster.
Ice and rod open.
A caring hand, an honest smile. It's the familiar faces of the core nursing team that Dino Lakakis says got him through serious illness.
I was in the hospital the first time, long-term care, for about 118 days.
That was just the beginning. Dino's heart failed, and after months of watching the seasons change, he received a life-saving heart transplant.
I know it made him feel very safe and very secure in the knowledge that he was being looked after by people that knew him and that didn't just understand his medical needs, but understood his spiritual needs and his emotional needs as well, and also those needs of his family.
Dr. Barry Boylston says the core nursing program brings together a small group of nurses to provide a continuity and quality of care that's hard to achieve if nursing staff changes regularly.
Because it would take at least 20 minutes to 3 hours to get to know that patient well enough to do anything effective outside of just giving their meds to them.
Nurses Tony Grubbs and Joan McCaffrey say core nursing is about getting to know patients and sometimes going the extra mile to motivate them to get well.
I'll come in the morning and decorate the room before they wake up. So that way when they wake up, the first thing they see is this bright illuminated room.
It also gives me peace of mind to know that this core of nursing knows my likes, my dislikes, my health standards, and what to look out for.
Core nursing, making time in the hospital for patients like Dino as peaceful and as safe as possible. In addition to making the hospital experience as positive as possible for patients and their families, core nursing also helps reduce errors. The more familiar a nurse is with a patient, the less likely communication errors or other mistakes happen. For Medical Edge, I'm Vivien Williams.